Good evening. When I was first asked to participate in health talks, I was stunned, shocked in fact. I noticed the credentials and the experience of the other speakers, and I was thinking, why me? I have little experience with public speaking, I don't have any credentials myself, and I have no special talents. What do I have to offer? Then it occurred to me, I was asked because I'm an agent of change. What is an agent of change, you ask? They are not a super secret undercover operative brought in to make change without anyone noticing. They aren't armed with the most up-to-date gadgetry to change processes and procedures with the click of a button. Their quest is not a mission impossible either, but it may seem that way at times. An agent of change is someone who strives to find a better way to do their job every day. Someone who rises to create a patient experience within a challenging environment. Someone who believes change is not something to be feared, but embraced in order to make a difference. Someone who does more than is expected, not for the recognition, because it's best for the patient. An agent of change takes into consideration the impact that their actions and decisions have on their patients. After all, the patients are the whole reason that we're here. Without them, we have nothing. Whether you're in long-term care, extended care, acute care, doesn't matter. Agents of change are willing to impart their enthusiasm and knowledge to students and new staff. They encourage and support the growth of new ideas and ideas brought forth through others' experiences. This practice is self-renewing. When someone experiences this culture of learning and support, they bring that forward to the next group that comes through. Agents of change lead by example. They see what needs to be changed, step up, and get on it. Others will follow their example and become agents of change themselves. They may just be waiting for you to get the ball rolling. Surprisingly, it may be a naysayer or two. Agents of change are collaborators who strive to work with every team member to explore ways to positively impact patient outcomes. They participate in groups and committees to promote changes which are in the best interest of their patients, and they strategize to overcome barriers to the quality of life their patients deserve. Agents of change embrace and promote the inclusion of patients in their plan of care. This is incredibly important. The days of us telling people what's going to happen to them are gone. Now patients are involved and they're responsible for their care during their stay. And after all, they're the only ones along for the whole ride of their healthcare journey. Agents of change promote open communication between staff, families, and patients. The only way to move forward and improve our practice is to understand where we've come from, what we need to improve on. Our patients are our best indicators of our status. They experience the care provided on a daily basis, which makes them experts in receiving care. They can tell us if we are providing the level of care they deserve. Agents of change seek the most up-to-date best practice and promote it. They use evidence-based data to support their changes. They encourage each other to bring out the best from all team members. They understand the different ways in which people learn and use that knowledge to entice participation. Agents of change can be found in every part of the healthcare system. Our housekeeper, she's an agent of change, but she has no idea she is. She makes an impact on our patients through her interactions with them and watches out for their safety as she goes about her work. She does not officially have a duty to care about the patients, but she does, and every day she adds to their health and well-being through the environment she creates. An agent of change does not need all these attributes. Any one or more will do. What they do with them is of key importance. If you do nothing at all, you can't change healthcare. I don't know of a single person who has entered healthcare to do nothing. In fact, I've never heard anybody say, I don't want to do anything, I'll enter healthcare. Healthcare leaders need to recognize, challenge, and support those who show interest in making change, no matter what their educational background. For myself, I was lucky to have been offered the opportunity to gain knowledge and tools to make changes on my unit through releasing time to care. I felt empowered by the whole process and I'm happy to share those skills with others. Traditionally, however, change has felt like an all-consuming tidal wave, leaving disorganization and chaos in its wake. I'm sure many of you have experienced accreditation and the panicked implementation of processes just prior to the survey. But change doesn't need to be that. It can be a much easier process. If change was approached as an ongoing progression, it could feel more like a meandering river that is always moving forward and ever changing. With change being an ongoing activity, it becomes much easier to absorb as part of your everyday. Planning and implementation can occur at an even pace. Even when the river overflows, there is less chaos. In healthcare, many people resist change. They ask, why do we have to change? Why don't we do what we always do? To be honest, I've been guilty of that myself. But the reality is, healthcare is dynamic. Miss Nightingale provided the best care during her time. But would you want your loved one cared for medicine practiced in the 1800s? Probably not. Not every change will be a success, but instead may be a learning experience used to move forward and make the change which is successful. Henry Ford said, failure is the opportunity to begin again, more intelligently. Changes don't need to be huge mountain-moving undertakings. Instead, start small. Small changes grow into big changes. One of the many changes my unit has experienced is around hand hygiene. We talk about it frequently, remind each other about its opportunities, and of the last year, my unit has won the trophy 5 of the 12 months and spurred on the competition. We lost the trophy in the last 2 months, but I'm proud to say we won with compliance rates of 93% and 91%. What are my hopes for the future of healthcare? I hope improvement can happen a little every day in an effort to make great change along the way. I hope change is no longer feared but embraced and appreciated for its value for everyone, but especially for our patients. We are always under construction, so remember where you've been along your change path so you can acknowledge where you've been. I hope for healthcare workers to realize they are agents of change and to continue to strive to create an environment of quality and safety and not settle for the status quo. Being a healthcare provider comes with a responsibility, not just an ability to collect a paycheck. It's about wanting more for the ones you care for as well as the ones you care about. Thank you.